This is the FirstNet add-on video for medical officers working in an emergency department. To access the FirstNet application, you'll need to click on the green IMR icon on the desktop of your computer. Once you've done this, the screen will appear where we choose the application of FirstNet. Click onto the FirstNet application and then log in using your Novell username and password. Once you log into FirstNet, the landing page for an emergency doctor is ED Launch Point. If it is the first time that you're attempting to log into FirstNet and you're unable to do so, you'll need to check that you've been granted the appropriate access, and that can be done by using the My Experience User Console button on the toolbar. On our toolbar at the top here, we have buttons available to click on. You'll notice that there is also a little drop-down button here with an arrow, which indicates that there's icons hidden behind. If I click onto that button, I can actually find the My Experience User Console link here. To be granted access to FirstNet, you need to have R4 Doctor Emergency ticked. So if you're unable to log into FirstNet, please perform this step from PowerChart. You would log into PowerChart, access My Experience User Console from the toolbar, and if you are registered as an R4 Doctor Hospitalist, please click into R4 Doctor Emergency. You would then save, and then you'd be able to log into FirstNet. Moving back to my toolbar at the top, we discussed how some of the icons were hidden behind this arrow. Whenever there's buttons hidden behind an arrow, to the right of that is 4 vertical dots, and we can actually click onto those dots and drag the toolbar down to pop all of the icons on display. I'm now going to click back onto ED Launch Point. By default, my ED Launch Point has landed on Princess Alexandra's tracking board here. The first thing I'll be showing you in this video is how to change your location. There's an icon over here to the right, which is the menu icon, and when I hover over it, I get the option to change location and check in, both of which I will be doing in this video demonstration. We select the appropriate location. For the sake of this video demonstration, I've chosen Logan Hospital. Now ED Launch Point displays for the patients in Logan Hospital. The next thing I'm going to do is check in. So again, I hover over the menu icon and I'm going to click on Check In. When I check in, my name will appear here by default for my Novell username and password. The display name that is here will be your initials. You'll pick your provider role from the list and pick your default relation. Ask locally what the associated provider colours are for your emergency department. Different providers will have different colours assigned to them for ease of identification on the tracking board. For this example, I'll choose navy blue for an SMO. If you have teams available here, you can assign yourself to a team. Please ask locally in your department whether you assign yourself to one team or all teams. Ensure that your available provider box is ticked down here, and then we can click OK. I've now checked in and I would be able to assign myself to the patient. Before I do my navigation of ED Launch Point, I'll discuss a few of the buttons here on the toolbar. The ED Launch Point button can be clicked and it will always return you back to the ED Launch Point. We have the ED tracking list. Again, it's an overview of all the patients in the emergency department, and again it has a lot of communication on this board here. However, it is a very busy screen and doctors work from ED Launch Point, but there is a tab on this screen here which would be of interest to doctors, and so I'll run through that now. It is called the LGH FAQs tab. And this is where we can click onto that tab, and this is where we're going to be able to see any patients who have exited the emergency department but you want to access their chart. So we can change the filter here to access previous presentations, and we would select the appropriate date range. We have the ED floor plan, where we can see a visual representation of the floor plan for your department. So you would pick the floor plan and you can see any patients that are allocated to beds. We can see which ones are available and which ones have a patient admitted to them. If I hover over the bed, I can see the patient's name, and if I click to select, I get a summary from the ED tracking list down the bottom here, so I can see their information. I'll come back to Message Center, as this is an important screen that we'll be doing some training from in this video. We have my Experience User Console where we just checked our access. We have the Change User icon. So if yourself and another clinician are sharing the same computer and accessing the same patient's chart, you can very quickly log in and out of the system so that anything that you enter, prescribe or document into the patient's chart will be documented under your Novell username or password. We have the exit button, and it is important to always exit the application by clicking on the exit button here and not by clicking on the red X in the corner. If we click on the exit button here, it will save all of our settings, and so the next time we log in, for example, my toolbar will be expanded as such because I have clicked on exit and it saved that as my default. Clicking up on Message Center. Message Center is an important screen, and this is where we need to check our orders, our results and messages that will appear here. Any results that will need endorsement will flow through into Message Center here. It's important to check these at the start and end of every shift, and it is best if they can be endorsed as you see the patient. However, with imaging coming back in 1 to 2 days, you may need to check here for missed fractures and contact the patient or GP accordingly. We can also see that we have an order here to be co-signed. If you ask a clinician to place an order on your behalf, they can do so and you'll need to come in and co-sign. I can see that I've got one order here to be co-signed, so I'm going to click on that order. I'm going to click on Open, and I'm going to read the order that's here for me to co-sign. The patient's banner bar appears at the top, so I can see who this order has been placed for. Below that, I have some information here that says that the original order was entered electronically by a registered nurse, and they have documented that it is a phone or verbal co-sign order from yourself. So you would very carefully check the details of the order here to ensure that it is the order that you requested. And if it is, by default, the action pane lands on approve. So we could say OK, and that would co-sign the order. Or if we had a long list, we could do OK and next. You can see that you can also refuse and you can forward as well. And you can enter comments here too. I'll now X out of that message. I'll now talk about the proxy tab. Proxies need to be added when you're going on leave or if you want to give or receive access to another clinician's inbox. I'll demonstrate how we would do this. We would go to the Manage tab, and you'll see down the bottom here we have the option to give or receive proxy access. So in this scenario, I'm going to give proxy access to another clinician. So I click on the Given tab, I click on Add, and I type in the name of the clinician. If there's multiple matches, I can click on the magnifying glass and choose the appropriate doctor from the list. I can then select my date range. So I'll grant access to my inbox for 2 weeks. I then have a list of available items. I can either individually select which items I want to give proxy access to, or I can click on Grant All, and that will grant access to all items in my inbox. Now that I have done that, I could do Accept and Next to give proxy access to another clinician, or I could click OK. Now I'm going to click on ED Launch Point and start the navigation of ED Launch Point. At the top of the screen here, we've got the blue pre-arrival icon. If you're ever unsure of what an icon does, you can always hover over it and it will give you a description. Pre-arrival should only be completed by consultants and registrars or senior nursing staff. So we would click onto the pre-arrival icon, and the pre-arrival form opens. There's no mandatory fields here, so you can put in as much or as little information as you'd like to. We have the boxes here to enter in their vital signs. And we also have other information down the bottom here, and we can free type information into this box here. Once we click OK, that pre-arrival will now appear on the tracking board. Next to the pre-arrival icon is our tabs. I'm currently on the LGH All Patients and Pre-Arrival tab, but note that I've also got a tab for My Patients Only, All Adult Patients, Adult Resus and Acute, and if we look here there's a drop-down menu which indicates that there's more options here as well. So we could pick our filters here. We have a search box here, so if there is a patient on the ED launch point, you can search for them here by typing their name in. Your name will appear here. And again, we have the menu where we can change location and check out. Below that, we have a view filter where we can tick and again filter what information we're accessing and viewing on ED Launch Point. We can also tick and untick these options here, see an overview of our patients and also of the department as a whole. I'm now going to discuss each column on ED Launch Point. The first column is the coloured column, and this indicates the status of the patient as a visual cue. If this box here is blue, it means there's an evaluation in progress. Grey means disposition determined. Orange means unassigned. Green means orders complete. Purple means pre-arrival. And pink means being triaged. We can see my pre-arrival at the bottom that I created, and we can see the colour code of purple there. The next column along is the room. This is the location where the patient is located in the department. We can change the location by clicking on the room number or name, as it's a hyperlink. So when I hover over it, it becomes a hyperlink, and I can click and I can assign the patient to another room. In our next column, this would have our triage category. Our training domain does not have this displaying, but this is where you would see Cat 1 to 5. Our next column is our patient information. We have our patient's name, which is a hyperlink into their chart, so we would click it once. And below that, we have their age, their date of birth, their sex, their UR number, and we have an icon here that indicates that the patient has allergies. You'll also see other icons in this box here, such as if the patient's represented within 24, 48 or 72 hours, you'll see an icon here. If a pre-arrival has been completed and linked, an icon will also display here as well. The length of stay column here can be reordered according to the greatest to the least by clicking on the top of the column. It is also color-coded to indicate the length of stay as a visual cue. Our next column is the providers column. Providers are listed by their initials and the respective colour that they selected when they checked in. We have the senior medical officer, treating clinician, registered nurse and multidisciplinary team. You would assign yourself to the patient by using this column here. Find the patient that you wish to assign yourself to and you click into that column. I'll click Assign. And my initials now populate into this column, and I now appear in the SMO column, and the colour that I chose for an SMO is now giving that visual cue to every person who's able to access and view Launch Point. Next column is our patient details. The patient details column displays the patient triage note. Once a diagnosis is entered, this will change to be the diagnosis, but until we enter a diagnosis for the patient, we will see the triage note here. You'll see there's a caption box below, and if we click into that, we can see we can type in clinical comments, and the nursing staff can also type in nursing comments. I've now very quickly added communication onto ED Launch Point to be visible to all clinicians. Our next column has the heart in it, and this lets us know that whether or not the patient has vital signs. If I click onto the column, the screen will appear. We can see over here to the left, we can see the vital signs, and we can see the vital sign results here. You'll see that the results are colour-coded, with orange being above the normal range and blue being below the normal range. We also have the arrows as well for this. I'm now going to click on Close. If the heart had a red outline, such as this red outline here, that would indicate that the vital signs were overdue. Our next column has a pill. I can see from looking at ED Launch Point that my patient currently has no medications ordered because there's no pill in this column, as there is with this patient here. And this patient has overdue medications because we can see the red column here. When we hover over it, we can see the medications that are ordered and due for that particular patient. Although we don't have any medications, I am going to click into that column because I'd like to show you that this is where you would see any medications ordered and when they were due. And over here to the right, you've got a list of favourites, and you can actually place medication orders from this favourites list. They are statewide favourites and they can't be modified. For the sake of demonstration, I'll order a dose of endone for my patient by clicking into the box here and clicking Sign. The order screen appears, and I need to fill out the missing mandatory information before I can sign this order off. And now if I refresh this screen here, I can now see the scheduled dose of endone that I've just ordered for my patient, and the status is showing as ordered. So I've managed to place an order for my patient, and I haven't even needed to access the chart to do so. I've done it straight from ED Launch Point. Our next column is the pathology column, and again we have no pathology ordered for this patient, but I'll click into the column because again I'll demonstrate that if we did have any results, they would show here. We'd see the results over here to the left, and we could also filter to do flow sheet, quick view, or order status. It displays the results of the current encounter only, and if you did want to get more detailed information, you could click on the word labs and it will link you through to that section of the chart for historical data. Again, we've got our orders over here to the right, our favourites, and we can place orders from here. So we could order a full blood count from here. I could sign this order as I previously did with the medication, and I could close this screen and then I could click onto the next column from ED Launch Point. But I'm going to show you that you can actually access it from here. So we can also move through the columns either in this screen here or directly on ED Launch Point. If the patient had an ECG, we could see it here. If it said completed, we'd be able to click on that to view the corresponding ECG according to the date and time, and we can also see previous ones from here as well. We have the order as well where we can place the order. If the patient has any radiology ordered, we would see medical imaging reports here, but not the actual image itself. The status here would indicate whether or not the exam was completed or if the report was available. If the report is available, you can click on it to view the report. And again, you can select an order from your favourites here. If the investigation that you wish to order is not showing here in the favourites, you can click Orders and you can search for the order. The next box along is the patient care. We can see that we've got patient care orders because we already have a dark icon up here. We know they're overdue because there's a red bar below, and it's the ED assessment adult that needs to be completed by the nursing staff. Again, we have our favourites where we can place orders, and if the order that we wanted to place was not there, we could click Orders and search. And the final one here is the consult, which is the phone icon. And this displays a list of consults that the patient has been referred to. And again, favourites are on the right, or you can search up at the top here. It is important to complete this once you've referred a patient because it allows to keep track of whether a referral has been made or what the patient might be waiting on. So we could do that very quickly by clicking into an order. I'm now going to click on Orders for Signature and sign these orders off. I'll close my screen now. When I refresh my screen, you'll see that we'll now have bold icons next to our patient on the ED launch point, indicating that we have medications, we have pathology, and we have consults ordered for our patient. Continuing with our column navigation, the next column is the physician notification column, which has a tick box and a P next to it. This will list any activities that need to be completed by the treating clinician, such as co-signing orders or if there's imaging to be reviewed. And the next column is the nurse activities column. We can see the nurse has 3 activities to complete, and if we hover over it, we can see what they are. You'll note that one of the activities that the nurse needs to complete is the administration of the endone tablet. So when you place that order for endone, it populated a task in the nursing column to complete that task. And we also see the blood droplet, which indicates that we also have that specimen collection, which again, you just place the order for. So when you place the orders, you've also sent nursing tasks to the nursing staff. Next we have our status column, and this displays the current status of your patient. And in this box you will either see unassigned, evaluation in progress, admitted to general ward, awaiting ward admission, and time since the status has changed will also show here. And our final column is documentation. It'll display any documents that have been signed or are in progress by a health provider, and they can be accessed from this box here. However, the box is white, so this indicates that we have no documentation, because when we do have documentation, the box becomes green and has a tick placed in there as well. I'm now going to scroll back across and I'm going to access my patient's chart, but before I do so, I'm going to show you that now we have had the colour change here because we have an evaluation in progress. And I'm also going to show you, because I assigned myself to that patient, I can actually use the My Patients tab and really filter down ED Launch Point to only show the patients to whom I'm delivering care. I'm going to open this patient's chart by clicking on their name. A warning has appeared on the screen to let me know that my patient doesn't have allergies recorded. Please document allergies. No allergies have been recorded for this patient, so I'm going to click onto that hyperlink. After consultation with my patient, they've advised me that they do not have any allergies, so I'm just going to document that by saying no known allergies, and that will also stop that alert from firing every time the chart is opened. It now displays as no known allergies. The patient's chart opens by default on the ED summary, and this is very similar to the doctor workflow in Power Chart, but it has the triage information at the top here. ED summary can be used to write your documentation, but remember that the document isn't created until you've pulled it through by clicking Select Other Note. So this is a good screen here for typing in and making a draft version of your document. So for example, if I wanted to put in the history of present illness, I could type that in and click Save, and that will save that piece of information onto my screen here in draft form. I would then go through and complete it all. When I'm now ready for this to become a document in the chart, I can click on Select Other Note. And that'll take me through to the documentation screen. Some doctors go automatically to the documentation screen and add their document here. Either way, you'll be presented with the note type, where we must select the correct type. And we can choose the note template as well. So for example, I'm going to select the ED note. You'll notice that the ED note has got a gold star next to it. That's because I have clicked into it and selected it as my favourite. So if there was particular templates that you like to use, you can click to make them your favourite, and then you can actually click on the Favourites tab here and really filter down what you see. You can always come back to the full list if necessary. I'll choose the ED note, and before I proceed, I'm going to give it a good description because this will indicate what kind of content and material is inside that document. For example, if this note related to the short stay ward round and it was written by the RMO, I would put that information in here as the title. Now I can click OK. The data's pulled through from the patient's chart into my note, and we always click Sign Submit. We never click Save. By clicking on Sign Submit, we've now saved that document into the patient's chart. Please note, if you do enter your documentation directly by clicking on Add and selecting your progress note from here, please note that any data that you type into the note will not flow back into the chart. For example, if you document an allergy into a note, it will not populate up here into allergies. However, if you enter the allergy into the chart, it will remain in the chart for future admissions. I'm now going to refresh my screen and I can actually have a review of that document here. Now that I have a document, I'm going to go back to ED Launch Point and scroll to the right and demonstrate the icon that you see when there is a document available, and you can hover over it. And because of the title I gave this document, it's very clear to see who wrote this document and what kind of content could be in this document. I'll now go back into my patient's chart by clicking on their chart here. And I'm going to talk about diagnosis, adding a diagnosis. All patients that are seen in emergency departments require a diagnosis, and this includes those who are being admitted or discharged. The type of diagnosis that attracts ED funding is the working diagnosis. And there's a few ways that we can add their working diagnosis into the patient's chart. One way we can do that is by going into the Alerts and Problems screen. We could add a diagnosis at the top here. And you'll see that the diagnosis type defaults to working, and it's very important that that is left as working. We've got folders down here where we could click and select a diagnosis from within these folders, or we could free type it into here. I'm going to cancel this, and I'm going to go back to ED Launch Point, and I'm going to show you another way we can enter in a diagnosis for our patient. In the patient details column here, we are currently seeing the triage documentation. However, if I click onto this, it will open up the box for me to enter in the diagnosis. It's important that this says this visit, because this visit relates to a diagnosis. If it was chronic, that would be entering it as a chronic condition in the patient's chart, but it would not be the diagnosis. But it defaults to this visit, but it's worth checking to make sure. You would then type your diagnosis in here. I could press enter and that would document this diagnosis into the patient's chart. However, I'd like to show that to you the third way, which is during the discharge process when we're doing the statement of attendance. Now I'm going to talk about the discharge process. To discharge our patient, we can right-click on their name and we can go down to discharge process. This will open up the statement of attendance. You'll notice over to the left-hand column, we've got two missing mandatory fields. They're showing in yellow. So before we can sign off this statement of attendance, we need to put in the working diagnosis, which is the third way we can do this, and we need to put in the depart ready time. I'm going to enter the patient's working diagnosis from here by clicking onto the pencil. And it brings me to this screen again where I'm going to add the diagnosis. I'll select from the list. I'll click OK. I'll carefully check to make sure that the type is working, and I can click OK. And I can close that screen. I've entered the working diagnosis now, and it's pulled through into the note here. Next, I'll talk about the body of the letter. We have the word comment here, and when we click on the word comment, a Smart Edit control box will appear, and we can type our information into here. We would type the information into the note that was relevant for our patient. Now, if I want to go down to the next line, I'm going to press enter on my keyboard, and you'll see that it actually closes the box and populates the information directly into the screen here. But if we wanted to go down a line to continue typing, I'll talk through how we would do that. So again, I'll click onto the comment box and it opens the Smart Edit control again. I now know that if I press enter, it will close the box and populate the information onto the screen. So what I want to do is move down a line. So to do that, I'm going to press down the control key and then press enter on my keyboard. I'm still holding control and I'm pressing enter again, and I can continue to type my documentation into the screen here. Once I've done so, I can click OK. So now the patient's comments are entered here. I'm going to click on clinician signature and enter in my details. Remembering I'm going to hold down the control key before I press enter to go down to the next line. Control and enter, and I could type in my provider number. I've now populated that information here. The second mandatory field is the depart ready time, and we click on the pencil to indicate that the patient's ready to be discharged. Only click on the pencil to say depart ready if you've finished treating the patient and they are in fact going. The exception to this would be if the patient's being discharged from short stay, and if they're being discharged from short stay, you'll see that a purple tick will already be present, so you wouldn't need to tick it again. You would click the pencil for depart ready, and this box would then become grey and it would no longer be showing as mandatory. However, in our demonstration domain, I am unable to demonstrate that, but clicking on the pencil here will document the depart ready time, and then you could click on print and you could print this out. You'll notice now that my diagnosis just updated on ED Launchpoint because I entered a working diagnosis. So we're no longer seeing the triage note, we're seeing the patient's diagnosis here. If your patient's left the department, we can update the rooms so that this bed becomes available, and we can communicate to other clinicians that the patient has left. Check locally in your area which option you would select from the following list. For this example, I will be scrolling across and selecting departures, but if you ask locally in your emergency department, they will tell you which is the appropriate selection here. That will then update and show that the patient's ready for departure, and you'll notice that the colour just changed to pink. Finally, I'm going to discuss the importance of endorsing results. Remember that results need to be endorsed, and we check at the start and end of every shift, and there's 3 ways that we can check results. Number 1 was through the message centre. We would go to the inbox tab, we would see the number of results that needed to be endorsed, and we would select and endorse from here. There's a video available on our website, Metro South Digital. If you are interested in watching the video of results endorsement, you would need to search for results endorsement on Metro South Digital, and there's a short video available that demonstrates this. The next way that I'm going to demonstrate how we could endorse results is from the toolbar. If we have a patient's chart open, we can find the results endorsement icon on our toolbar, remembering that it could be hidden. And there's our endorsed results. This screen would appear here and the results box opens. If you change your display to filter to the last 12 hours, this will mean you'll only be endorsing today's results. And remember that you will need to review all results and open up any that are documents. The endorse button will be greyed out until the result has been opened and viewed. Once you've done so, you can then click endorse. The third way that you can endorse results is directly from the patient's chart in the results screen. There's an icon here which is the sign icon, and if the patient has got results to be signed, you would see that this icon would become red or blue. And as previously mentioned, if you can't remember which icon is the one you used to sign, just hover and it'll tell you what that icon will do. Remember to always endorse results. Remember to always add a working diagnosis, which can be done from ED Launchpoint here. It can be done from the patient's chart here, or it can be done as part of the statement of attendance, which you would access when you right-click and start your discharge process here.